Minister, what is the ministry's position on the AstraZeneca vaccine? Is it still being administered?
Right. So we anticipated that question. And as a result, I'm going to ask the CMO to take the mic and to give her clinical response. I can give a policy response after. CMO. Oh.
Hi, morning everyone. Specifically to answer your question, no, we're not administering the AstraZeneca vaccine anymore, simply because it has not been on the market. Okay, and just generally to address the concerns that have been in the public space for a few days. AstraZeneca had released their vaccine from late 2020, and Jamaica started using the vaccine in March 2021. The vaccine had gone through various studies and had proven to be highly effective vaccine, specifically in terms of reducing serious illnesses as well as reducing death. And so the vaccine was widely used early in the response to COVID, and over 3 billion doses were produced worldwide and were provided to persons. It is estimated that over 6 million lives were saved because of the AstraZeneca vaccine. Now, all medications do have side effects, and very early in the clinical studies that were done, the serious side effects, the rare side effect of blood clots was not discovered at that time. But certainly the process of any new drug being released on the market does not only stop at clinical studies. After the medication is being used, then you have post-market surveillance that continues to assess if there are any effects from the vaccine. And from as early as in the second quarter of 2021, we would have been alerted to the possibility of side effects, including clots associated with AstraZeneca. I remember at the time we had several interviews about it as we sought to reassure the public on the use of the vaccine. This complication is extremely rare, occurring in about 2 per 100,000 persons, where there is an association of the formation of clots. And within that group of persons that can have this effect, then of course you will have a small percentage of persons that will have serious outcomes. And these side effects are common with all medications, but in response to that, you would have found that there was some decline in the use of AstraZeneca. However, at the time, we always have to weigh the benefits against the risk. And AstraZeneca was a main tool in what we had to respond to COVID at the time. And so the benefits far outweighed the risk that were there of these extremely rare events, and so the vaccine had continued to be marketed. But as the other vaccines became more available, the RNA vaccines, the Pfizer vaccine, Moderna, then of course in many countries you had a decline in the use of AstraZeneca. And also in continuing the manufacture of vaccines, you would have found that the other vaccine manufacturers had developed new vaccines against the new variants that were coming on. And AstraZeneca did not. It's simply a matter that the technology that was used for the production of AstraZeneca does not lend itself to so much manipulation, which is the viral vector technology. But the other vaccines the other manufacturers would have moved ahead with producing new vaccines. And of course, as those became more available, there was even further decline in the use of AstraZeneca. And so therefore, the production, the manufacture and supply of AstraZeneca decreased, and it had stopped being produced. The UK Vaxzevria, they stopped producing that in 2022, and the Covishield was stopped being produced by Serum Institute of India in December 2022 as well. So, sorry, 2021. okay, the vaccines, they had stopped producing them. So there was demand, the demand had decreased substantially. And so it is understandable that the manufacturer would start withdrawing the licenses that exist. So in Jamaica, we continue to vaccinate against COVID, following the WHO guidance in terms of boosters that are available. And since July 2022, that is when our last dose of Astrazeneca, the set that we had expired, we have not been offering Astrazeneca anymore. The side effects I note that persons are concerned about tend to happen between 3 days to 3 months. So some persons are wondering, if I had received AstraZeneca then in 2021 and early 2022, am I still going to have this possibility of these side effects? And the answer is no. The likelihood of developing those side effects, 3 days to 3 months. Okay, so I know that's something that persons are worried about. And as I said, the ministry still continues to collect information on persons who think they may have suffered side effects, and we investigate them to see if they are in fact related to the vaccine.
So can I summarize, because I think the clinical perspective requires clarity sometimes on what is most concerning to people. So essentially, and this is not to devalue the concerns that may be there, all medication comes with side effects, including vaccines. You only need to watch those commercials on American TV when they introduce drugs, and then they start to talk fast and tell you all the side effects that are there, right? 100 different side effects. We only use vaccines in Jamaica as a policy that was subjected to very stringent validation. In fact, there were debates at times that we should embrace vaccines, whether from other jurisdictions, some of them friendly jurisdictions, Cuba, for example, even China initially, that were not approved by the WHO's validation committee, and we never did. So I heard you talk about Cuba and why we didn't take Cuban vaccines. We are very friendly with the Cubans, of course. We benefited a lot from their personnel, which we appreciate, but we never embraced the vaccines because they were not approved at that level. And the same for other jurisdictions. So we were comfortable with the risk that would normally be applied based on that validation. And so that vaccine was available. Remember the context, vaccines were short and we embraced. As CMO said, the vaccine was known to come with side effects in a very small percentage of times, and that those side effects would be most noted within 3 months of taking the vaccine. And I'm looking here on the report, which CMO may not have mentioned, that there are no reports to date of any cases in Jamaica of persons, Jamaicans, suffering that side effect, that rare side effect involving the AstraZeneca. So we have clinically on record no report of. And those who would have taken would be highly unlikely, if not impossible, to have that side effect now, years after taking the vaccine, and we no longer are distributing the vaccine. So I think that's clear. I believe too that when AstraZeneca sent out the notification, it was a notification to discontinue production. And there seemed to have been some interpretation or extreme interpretation that it was a notification based on a recognition, maybe, that the vaccine somehow was going to, create an adverse reaction to people who have taken it, how many millions of persons who have taken it. And I think it has been, the dialogue around it in the country, and unfortunately some have sort of exaggerated it. We do have an environment now where the anti-vax movement is big, an environment where the political climate is somewhat toxic, and so sometimes we got interpretations around this that created an extreme view. And I think it's unfortunate, because it's not our intention to make the public panic around these issues. But I believe we'll continue to monitor it, and the CMO will be the lead spokesperson on that because it is a major clinical matter. Thank you.
Thank you. Thank you very much, Minister. Naomi, do we have another question?
Yes, we have two more for Minister, including one from Arthur Hall, but I'm just recognizing the fact that IRFM asked questions related to that. Minister, you have answered in terms of any numbers of persons who might have been impacted. None?
None on record.
As you're saying, and therefore the issue of compensation is negligible because there is none.